Thank you so much again, dear Dr. Siroli, and it's my pleasure to present next our speaker, dear Dr. Pika Jokelainen. She is not only head of section Statens Serum Institute, but she is also organizer of a lot of events. Even the last one, it was International Congress of Parasitology. It was 15 and it gathered more than 1,000 parasitologists all over from different countries of the world. And it was really in person and it was fantastic after a long period of COVID and restrictions. So it's my pleasure. And microphone is yours, please.
Thank you so much, Dr. Kalat, and thank you all for the kind invitation. And I'm very happy to contribute to this event. I mean, congratulations to the organizers, even though this you mentioned that having an event on site is nice to meet each other. But what we have learned during this pandemic, that it's possible to meet like this. So I think this is also wonderful. And my talk, I will actually go from the US to European experiences. And Marina, you promised to show my slides. It will come. So I'm very happy to tell a little bit about One Health European Joint Program. That is a large, still ongoing program that kind of shows how it's possible to work with One Health, but also there are, of course, challenges and things to learn and what could be better. So I think it's this project started, we are now in the 5th year, so it's really the time to learn about it, I would say. I'm based here in Copenhagen, Denmark at Statens Serum Institute, which is a One Health Institute. That's quite rare, I would say, still globally. So public health institutes, we have been for more than 120 years now. And then the last few years, we have also had the veterinary preparedness functions. So really in the same laboratories, in the same groups, we work with these across the fields. So that's kind of where I'm sitting daily basis. And I have been heavily involved in this One Health European Joint Program. And here are the 2 points that I will focus on in my talk. So One Health laboratories, what have we learned to those, and also One Health science policy interfaces. So on the next slide, there is just a general overview of this One Health EJP, as we call it. So it is a 5 years, 9 months project. Started 2018. Of course, we have been challenged by the pandemic time to work together, but it has a substantial funding and it's co-funded. So the partner institutes themselves also partly fund the activities. Here's all the logos of the partner institutes, altogether 44 partners across Europe, and they represent public health, animal health, and food safety. So not fully the all of One Health, like we heard previous discussions also, like we really need to think about it even wider, but this was within this mandate and program and plan. And very special thing is that all these partners had a mandate from their own ministries. So they are like those places that are linked or under a ministry and or have some reference laboratory functions or other national reference functions. So that was like directly by the composition, there's a link to national level stakeholders. Next slide shows then the main focus of this initiative and collaboration. So it really aims to be a landmark. And I think it's been possible to build it and show it's useful to work together on these topics. And it covers really from different things, from the laboratory to really the responses and communications and so on. And on the kind of topic side, so there's focus on foodborne zoonosis, antimicrobial resistance, emerging threats, and a lot of like integrated activities to try to really get the way of thinking into the daily work. On the next slide, there's just a key thing. I also provided it in the chat and it was kindly shared there. So there's a website of this initiative and there's a lot of information. For example, under it, there's a high number of projects, joint research projects and integrative projects, and those can be found there, and each of them have a website and even more information. So you can find your favorite pathogen or the one that you really think is important to pick up. And there's really nicely contact information and so on. Next slide, I then summarize some key general questions for One Health laboratory work, because here at my institute, we really have this now in everyday life. That's very often it's the same lab technician who is doing the analysis on a sample that can be from a human or an animal. And I must say that the IT programs, they are separate. And then the data again comes together for looking into the epidemiology and so on. But I mean, just these are just, I don't have answers to this. Mainly to like think if you would consider in your country or your institute or in your collaboration, why to do at the laboratory level One Health approach and really simplified. It's like just same methods for animals and humans. Could be also environment, could be also food and so on. And why should we do that? And what are the barriers and what makes it easier? And I would say that these kind of projects that we have had in this initiative, they have really moved it forward, because there we had the mandate from our local ministries to say, like, you can use your time on a One Health harmonization of the methods, because otherwise very easily we just continue in the silo thinking. And then also to develop method across. And sometimes it is the human side, sometimes it's the veterinary side that has the more advanced or better method, or has been working more on the development of the methods. Barriers are very many. One is also that the laboratory level, not all laboratories, this is the biosecurity and other things, and also just permissions, what kind of samples can we handle and receive, and so on. And sometimes some pathogens have a totally different form in humans and in other hosts. So even though there has been an analysis for a pathogen, but maybe it's totally different sample material if we want to look and try to find that pathogen in another host. But of course, there's a lot of synergies. It can be cheaper, better. It's easier to upscale also if we suddenly need to do more analysis, if we have been working together beforehand. So there's also very many benefits. And I think it's been really interesting to learn about how it is across the fields. Next slide actually then shows one of those projects, just the name of it, or HarmoniCap. It has a long name there too, but this was one of these integrative projects under One Health EJP, really focusing on harmonizing methods. So I would recommend just to find that on the website. So there's a lot of outputs, and what was interesting that it was including bacteria and parasites, and that was also really a learning thing to talk across. We are also a little bit in the pathogen type silos sometimes, and there can be really different challenges, but also really useful solutions in some other field. So really, I would encourage just to bravely put it all together in a same soup. And there was also focus on AMR in this one. And there's then a specific antimicrobial resistance focus projects, also others. Next slide simply very briefly summarizes some key outputs, mainly from this HarmoniCap. I was just thinking just this and the laboratory work, but also some of them are more general from the One Health EJP. I think in this HarmoniCap projects, it was started by mapping the capabilities and capacities and interoperability of laboratories that work in one or several of the different fields under One Health. And there was a first pilot survey and then the real survey run. And during this process, because it was happening in the pandemic time, one new thing was added, and that was adaptability. How good are our laboratories to actually change when we need to? And it can be to many things. We know all. I mean, this world seems so crazy. What kind of changes there are to our daily lives and will be, and so it's so many things. It's just about the resources, just about very many things. Of course, in this case, it was focusing and the experience came from the pandemic, but it can be also any other challenge. How prepared are we for that? Key outcome is certainly that many approaches were harmonized. Some more, some were more challenging, and it was more like just steps in that process. And also new methods were implemented at many different laboratories. So now there's like more laboratories using the same approaches. So there's more, I think also that you don't feel so alone. You can ask somebody, there's the network working together. And what is brilliant is that then the data is more easily comparable. And also the new knowledge is stronger because then you can do multi-center studies. You don't need to, sometimes gathering samples is a challenge. But if you do it together with many countries, maybe it's enough that you gather a smaller sample size and then you can say something in a wider scale. So that's also helping. I think it's easier to come into the project. You don't need to have full resources. And certainly the aim was to improve the detection and characterization of pathogens, and this was also has been well achieved. So like it helps to work together, and I would say exactly in the One Health way. That's sometimes I have one example was mentioned this that I have also had focus on parasites and also other zoonotic pathogens, but quite a lot parasites. And there, for example, Echinococcus species. So in the human side, it's very often still just that echinococcosis without going which species is causing that. While on the animal and veterinary side, going to the more details, what type of Echinococcus is causing this infection has been more normal, and better understanding that these different species also within the Echinococcus granulose complex, they have really different life cycles, totally different animal host geographical areas, but it was kind of a news to the human field, and we've been working on that. Including in our laboratory here, we have updated our methods. And one thing is also for One Health approach in the laboratory work that it really helps to, when the same methods are used across, then it's easier to identify when there is a zoonotic transmission and track the sources, find it, where did it come from? And in outbreak investigations, not only focus on the humans that got sick, but where did this come from? And maybe there's some other sample types to include. And overall, I would say these cross-sectoral collaborations, that's a strength, has been really useful. And final point on this slide is that indeed this is EU funded, so there's also even a requirement, but also it was really important from the start that all the things needs to be available, because it was only those 44 partners in this project, but these are useful to others. So they are in Zenodo and very easy to find there. Then we go into the next slide that changes the topic to the other point that I wanted to bring here is this science policy discussion, because often we, especially One Health field, is a bit complex, and we then struggle with that how our kind of the policy structures are often in silos, and how have we been working on that. So next slide, there's the team actually working on this. So in One Health EJP, so we have 2 people in Germany and 2 here in Denmark in this team. And this is really like one of the working packages in the project. And it's called Science to Policy Translation, but that was 2017 when this name was given. Now I would end it, like change it, maybe it's not just translation and one way, it's more like dialogue. Science and policy, or science policy interface, or something, because it goes 2 ways. So the whole thing has had focus on us gathering and asking for input for needs from the stakeholders, and we talk about national ministries and others. We also talk about the European agencies and also global organizations in the field, like what do they need and how can our projects and the initiative support that. And then really the topics, the research topics were selected largely based on this input. And that has been really nice kind of gap-based research, because then the research projects, for example, they don't need to use time to tell why they are important, because that was already identified by the stakeholders. So it feels like there's easier to get impact when this dialogue started earlier. And then there's also targeted dissemination, because One Health is difficult in that sense that there's so many things. So we've been really working on like making sure that each stakeholders, they might be more siloed or have their smaller mandate, but they get the information that is useful for them. Of course, we aim to increase the impacts. That's what we win all work. We want to make world better, and when we do some work, that it will contribute to that. Next slide shows then just really generally what kind of communication lines we have, but there is also a list of the different structures in our stakeholder committees. So we have the EU agencies, ECDC, EFSA are the most important, but also the environmental and the medicines groups are involved. And right now, actually, this has been happening during these years. So these different sister agencies, they have been working on a One Health task force. So that kind of structure is coming in Europe. That's at the EU agency level, there's One Health collaboration. It also includes the chemicals agency. And then the international agencies, so we have FAO and then the animal health side and WHO Euro in our stakeholder committee, so the tripartite. And earlier this year, this became the quadripartite. So it's also been nice during these years to see how this high level it goes nicely. But then I must say that in most countries, the national ministries, they are more silos and less linked, but maybe that will change next then. And indeed, we have different ways of communicating. On the next slide, it is simply summarized that we have, for example, meetings and targeted reports and workshops and support when there's a need for some information. And then I have 2 slides of specific examples. So next one is again an online tool. We have One Health EJP outcome inventory. So the next slide shows the link to that. It's also on the same website, and it's really like, because there's so many outcomes from all these projects, so it's possible to search there for some keyword and find those interesting ones. And this will be very soon strongly updated, because many of the projects are ending end of this year, and the last 9 months of the One Health EJP is more like the general structure. So really something to keep an eye on. And next slide shows just the teaser. This is then also available on YouTube and also on our website, through our website. There was this one 2022 event in June in Brussels, organized by EFSA and the sister agencies. And there we organized a side event that was like a lessons learned panel discussion of a high level people. And it was really nice. We had some of the agencies included, and Thomas Mettenleiter who is co-chair of the high-level One Health expert panel. And it was really interesting to hear where we are and where we should be going. So I encourage to find that video. There's a short version and the long version available, so they are both online. And then next line is only saying thank you for your attention, and I really hope that One Health EJP is something to deep into and look what's interesting. And it's been, I'm of course biased because I'm in there, but it's been encouraging that it's possible, and especially these links across countries and with the stakeholders. Thank you.
Thank you, Pika, for a great presentation and for this amazing work you are actually doing in your projects. And I encourage all of the participants to follow the link I shared in the chat, and you can see, maybe find something for yourself. So you're welcome to do that. Thank you once again. And